Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now. And if you haven't downloaded our podcast, you can go to any of those podcast downloading sites, whether it be Apple, Google, or any of the ones that are out there. We ask you to download our podcast. We ask you to like us. Please recommend us. Give us a review. You will be definitely, you'll be enlightened by the work that we have done here. We've been on the air now for 13 years. And what makes this show great isn't so much me, it's these extraordinary guests that I get to come to the show. And it's hard to believe we're halfway through the year of 2025. It is July 4th, and I want to wish America a happy birthday, and everyone that's listening a happy 4th of July. Be safe out there. Well, today is a very special day. About 4 years ago, I had this gentleman's partner here in the studio with me, Dr. James Deering, and they have grown immensely. So I'm really proud to have Dr. Jain here in the studio with me. He is with Synergy Health 360. They are a primary care practice firm, and they do a lot more. And I know Dr. Jain's going to share a little bit more with us. Well, welcome to the show, Dr. Jain.
Thanks, Bob.
It's good to have you. Can I call you Vin?
That's really great.
Okay, Vin, welcome to the show. And, you know, I think it really helps me to really give some, context to what we're going to talk about today is for me and our listeners to learn a little bit about you. So if you would mind, indulge me and our listeners a little bit about your background and where you trained and how did Synergy Health 360 evolve?
That's a great start. So I started as a surgical intern in a cardiovascular unit, seeing all the complex patients we see, going through triple bypass surgeries to dissecting aneurysms, you name it. Within 1 year, I realized this is not for me. I transitioned to family medicine and wanted to focus more of my time into prevention than complications. Later on, I decided to be doing integrative medicine and wellness under Dr. Andrew Weil. I had great experience seeing firsthand the best of care which can be provided at the early stages of life.
Can you give us, for our listeners, a little bit about Dr. Andrew Weil? I know a little bit about him, but he's kind of like a rock star in the medical field, at least in the integrated health, the homeopathic, the health side of medicine. I know that he was the guy that was really behind True Foods when Sam Fox created that restaurant. So tell us a little bit about you studying under him.
That's right. So Andrew Weil has been out for a long time. He created a new genre of healthcare with mind-body health, keeping it at a simple level. How do we breathe right? How do we eat right? How do we exercise right? And adding all those evidence-based techniques which are out there for thousands of years.
Right.
It's out there. How do we do it on day-to-day basis? Connecting with our activity of daily living, eating healthy, food as medicine, anti-inflammatory diet, exercising, getting our vagus nerve to work with us to relax mind, body, soul, and then follow yourself as a person, because every one of us have a different unique situation. We have our DNA, which brings our familial traits. Then we have acquired causes based on our lifestyle. How do we get the best of ourselves, working both with ourselves, lifestyle, and then like-minded healthcare providers who can see you as more tailored, personalized, holistic approach.
I love it. And the mind, body, and spirit. And seriously, I mean, healthcare has always been more akin to sick care and not really prevention and not really doing. I like to call it medicine 2.0. I think you and I talked about that, is really talking about, improving your lifespan. And by improving your lifespan, it is by living a healthier, happier life. And that's what our show is all about.
Exactly, and that's so inspiring to meeting you, see what kind of work you are doing with the show, with your organization. This is really amazing. We see two sides of the ecosystem, where we have been trained in high complex medical condition in a hospital setting. That's where I put in my first 10 years.
Mm-hmm.
By the time we see those cases, we see that it's already passed through. They have so many diseases, they're going through serious heart conditions. We are talking about surgical care. Now, how can we get it better at the primary level, basic level? Now, technology is helping us. We have so much out there with data. We can have monitors at the home level. We can get so much out there, but how do we make it simple for our day-to-day senior population?
Right, right. So you studied a little bit under Dr. Andrew Weil. How long were you studying with him?
So our fellowship was for 2 years.
Okay, so were you down in Tucson?
I was down in Tucson, University of Arizona. That was one of the reason, moved there. Was amazing to see how they were treating not just the patient population, but the community at the basic level. So they've created this unique fellowship for all comers. So in our class, we have physicians, we have even radiologists, we have like cardiologists, primary care physicians, nurse practitioners, you name it, and giving them a totally different level of approach towards patient care, more holistic, more personalized, mind, body, soul, as easy as working on the breath work, food we eat, how do we keep our mind engaged, and working as a community. It's an experience.
Right, right. So, in taking me and our listeners through this journey, so you spent a couple years down in Tucson, and you obviously came back up here. And did you come up here to join Synergy Health 360? What was the next step?
So after finishing fellowship, I was still involved in hospital medicine.
Got it.
So we moved to California doing hospital medicine work, and I continues to see this sick patient population, which we are in the healthcare all in.
Mm-hmm.
But my heart is all towards prevention. How can we get this early? So moving to Scottsdale, I had this unique opportunity to go back to the community and then transition out from the hospital medicine, setting up an ambulatory care setup where we have clinics where you see the patients as a family doc. You see for day-to-day problems.
Right.
Then we started to create like a co-op for healthcare providers. They can be in an independent setting, taking care of patients when they are sick, when they are not sick, they are healthy, wellness. And all of us have a different perspective, unique. My emphasis is on personalized medicine. I try to give more time to my patients, get to learn them, go at a deeper level with mind, body, soul, where they are at the journey of health and wellness.
Mm,
They may have some mental issues, they
right.
may have some anxiety issues, especially with post COVID. We saw so many different angles of healthcare needs. Back in the days, most of the patient used to come to the hospital getting care, but now majority of the care, 95% of the care is in the home setting, in the ambulatory space. Then how can we shift that gear?
Mm-hmm.
The resources we have are limited. How do we put all in for our patient population, which will be more than 50% in the senior living space?
100%. You know, I really like the fact that you took this to the communities because I mean, let's face it. You know, especially guys like me. I mean, you know, women are much better about their health, but guys, you know, we ignore a lot of symptoms. We, you know, don't exactly, you know, follow a really good eating regimen. And I'm this is a little generalities. I mean, for the most part, that's what you're dealing with. But I mean, being into the community and being embedded in the community is a really big deal. I would imagine that was a great transition for you.
Totally, you hit the nail. That's where we see it. We have women health, we have men's health. End of the day, how we prioritize our health.
Right.
Is it, you know, when we get sick, we see the doctor, or we get it early in stages. You know, we don't need to wait when things are already stage 2 and 3.
Right.
Prevention is the key here.
I love how you keep saying that because it's so true. Prevention is the key here. You know, what do they say? What is it? A pound of prevention is a something a cure.
Here you go.
There you go.
Prevention is better than cure.
There you
So
go.
we have to start early, enjoy on the wellness mode, activity of daily living combined with evidence-based techniques, eating good food, and then exercising, engaging the mind. But sounds so simple and easy, but do we see all of us doing it?
Well, you know what? That's a great place for us to leave off in the first segment. I told you these go really fast. We got 3 more to go. You're listening to Health Futures, Taking Stock in You. I got Dr. Vin Jain here in the studio with me. He's with Synergy Health 360. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our second segment here. I've got Dr. Vin Jain here with me. He is a partner and founder of Synergy Health 360. They're an integrated health care, primary care practice. We're learning a lot about them. If you missed that first segment, go up to our website at cypresshomecare.com. Click on the media button right below its radio show, and you'll learn more about Dr. Jain and Synergy Health 360. And you'll also hear about a lot of other shows we've done over the last 13 years. So, you know, I teed up this segment. First of all, I really bastardized that quote. It's an ounce of prevention is a pound of cure. So that's really what Dr. Jain was talking about. And really, we're talking more of a holistic approach to healthcare and really looking at the mind, body, and spirit. And that's really the genesis of what Synergy Health 360 is all about. And that's what Dr. Jain and Dr. Deering really created with Synergy Health 360. So, you know, Vin, I'd love for you to take us through, you know, you told me about your evolution, your personal evolution, and what really drew you. You know, you started out in cardiology and you did a lot of stuff and a lot of work with hearts, and you were like, there's got to be more to this. And I really believe part of you is saying, and I'm putting words in your mouth, tell me if I'm wrong on this, is that you're here at the stage where the damage has already been done, and you wanted to be at the stage where you could help people in our community so that they didn't have these bad hearts. You wanted them to eat and live healthier, happier lives, just like our show. And that's really what, you know, really led you to where you're at today. And I want you to pick up on where you left off on the first segment. And I'd love for you to take us through how you and Dr. Deering came together and really started Synergy Health 360.
Perfect. Thanks, Bob. Yeah, so you are amazingly doing these shows, and you see how much is out there. At one side, we have all the technology coming in. Then we have the wellness space. Then we have aging 2.0. We have the senior living community needing resources, help. And then we have all these gamuts of diseases. They are evolving more, like obesity. We have like more mental diseases coming in. Then how do we take a more holistic, comprehensive approach to them, right? When we see a person, we can go into silos, like we used to do it back in the surgical world when I was in that cardiothoracic surgery, looking into the damage has been done. Now how much of the time and effort are we putting together for the people who are high risk, and getting them to learn them, tailored an approach, personalized and holistic for them, and walk the talk, right? They also have mental challenges. They may have mild depression. Post-COVID, we have seen conditions like neuritis, long-haul COVID, energy levels are low. We can keep pushing them for more lifestyle, but with more technology, we have so much out there. We have amazing timing of the era where we connect the technology with the best healthcare options out there to prevent these disease burdens. Because at the hospital level where I have been working for last 10 years, we just don't have resources. We cannot keep getting all in the hospital admitted and then discharged back to home. Home is where 97% care can be delivered.
And that's where people want to be. They want to be home.
There you go. So the other data is more than 50% of our population hitting the senior living. Then comes the other side where the caregivers who were not equipped with it, not ready for it, now they got to help the family as well.
You're talking about family caregivers.
Exactly.
Yeah. And
that's a big one.
It is. I mean, we have over 50 million of them in our country that are doing the hard work every single day.
Exactly.
And not necessarily been given the tools on how to do that.
So that's where we should be putting our minds into it, using the technology. How do we help the ecosystem? How do we help our young family members help the seniors?
Right.
Because it's not about all the healthcare providers doing the work in a clinical setting or in a hospital setting. How do we empower our youth on the basic level? Like mental health is one example for it. We may have all the tools. I recently moved out to a unit which has almost everything you can imagine. And then I'm correlating myself more how others will feel about it. At one end, we don't have the resources in the community to provide, healthy food, exercise, and then they end up hitting into diseases. And at the healthcare level, what we see, we are seeing the patients with complications. We're dealing with polypharmacy, medications, and then follow-ups, lab work, and we don't have enough providers to take care of it, right?
We don't. We definitely don't. So I want to go back to how did the Synergy Health 360 come together? And you're 100% right. I mean, this is what I love about you, is because you've embraced so much as it relates to innovation and technology, but you're still delivering very personalized care. And it's not just you, but it's the entire practice. It's a holistic look. It's a feel. And, it's like we got you. And then I want to really spend our third and fourth segment really digging in and really talking about Synergy Health 360 and the qualities of it and why consumers here in the Maricopa County region, Phoenix MSA, if you would, should be looking to Synergy Health 360. So tell me how you and Dr. Deering got together.
Perfect. So as both of us have been working with the hospital systems with different level of care, now coming in a private setting where we have we have different level of patient care, or what we can do for them. So we realize that they are looking for simple answers, like doctors spending time with them, giving them some personalized time,
Right.
getting to know them, go at a deeper level. It's like mind, body, soul, right? Diseases follows it. Now we kept the simple process as a family doc, listening to the patient rather than running around seeing 20, 30 patients in a clinic, not able to give them enough time, rather than try to get them as much we can in our first intake, getting to know them, and then connecting them with our health coaches, with other team members,
100%.
getting to learn them more, keeping all the three modalities of care, which is health and wellness both. And then we are introducing a concept of membership, where we have certain resources coming from the insurance side, which may be not covered for wellness. Now many of these challenges are based on how much time, energy, resources we have. We know the problem, that we have high disease burden, we have mental health issues, we have lack of high quality provider access. We may have really good providers, but if they are fragmented,
Right.
doing different aspect of medicine, but they are not as a quarterback, listening to the patients, seeing where they are suffering, how we can get them to the next level with all the basics we have. So our membership goes into that deeper level. We give them some time, listen to them, and then simplify their medical problems, and then their access to care is faster, using technology, using phone systems, which can even have some AI attached to it, which is a big thing, because what we are doing is a team-based work.
Right. Right.
We are based on what we have and what we can come together with.
So in the third segment, I want to dig into the membership piece. I still, I'm curious to how you and Dr. Deering met and how you guys said, okay, we're done. We're not going to do this institutional medicine anymore. We're going to practice medicine the way it should be. How did that actually come about?
That was a perfect start.
Ye-
We have seen the other side of the medicine, and now we want to create something which is for all of us.
Well, you know what? You hear the music. I told you it goes really, really fast. So I want to dig in more on about Synergy Health 360. I want to dig into the membership too, because there's real value in being a member of Synergy Health 360.
Absolutely.
You're listening to Health.
100%.
You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth. I've got Dr. Jain here in the studio with me. He's with Synergy Health 360. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we are in our second half here. If you're just tuning in, I got Dr. Jain here with me. He's with Synergy Health 360, and we're having a fabulous time getting to know one another. I mean, this Synergy Health 360 is the real deal. This is a practice that really practices the mind, body, and spirit, and really understanding the purpose of integrated health. For those that want to learn more, go to synergyhealth360.com. So when I teed up this segment, the third segment, I really wanted Dr. Jain to talk a little bit about the membership and really joining Synergy Health 360 as a patient. You know, one of the things that's really challenging for healthcare, and I'm talking about for consumers, is really finding primary care. And you got a lot of primary care docs that are not taking any more patients. You got a lot of primary care doctors that are retiring. And you got a lot of primary care doctors that are not coming into the field today because they spent oodles of money in going to get they're going to school for medicine and the fellowship and internships, and the next thing you know, they got over $500,000 worth of debt, and they don't really see primary care as an option for them to really satisfy their obligations financially and really being able to do what they really wanted to do. So they choose specialties. So that's really why Synergy Health 360 makes a lot of sense, because they can be your primary care, and they can be so much more. And that's really what I want to talk to you, Dr. Jain, about right now in this third segment is what is that more? And you talked about membership, and I know a little bit about it to be dangerous, but what does it take to be a member of Synergy Health 360?
That's amazing, Bob. Thanks for summarizing and then
Yeah.
helping out to understand this model. So membership is based on, it's not a concierge medicine. It's about taking extra care of our patients where insurance doesn't cover the services. Now we want to start at a very basic level. What
Mm-hmm.
we are starting is at like $99 a month.
$99 a month.
That's it.
And what do I get for $99 a month?
So you get to see your doctor. You can have access to
And see your doctor, do I have to make an appointment and not be able to see you for a couple weeks, or am I able to get in to see you the next day or that day?
we try same day appointment and weekly appointments. We have monthly appointments. More importantly, you get to be with them with a good time. You stay with a doctor visit where you are not being rushed.
Got
Right
it.
now, if you go to the normal model, you have like 20 plus patients waiting in the waiting area. Doctors are rushed. They got to deliver all they can in that 10 minutes.
It's-
And then
I
document
heard,
all
I heard
what
the
they
number
can.
was 7 minutes. That's about what the
Yeah.
average is. That's not enough time.
Yep, it's keep getting worse, and now from the provider side, they have something else going on in their ecosystem. Now patients are coming in. It's so hard to get in a doctor's appointment when they come in with the issues they have. You just cannot solve it in 5, 10, 20 minutes. You need some time. You need to learn the person. You need to go deeper at the mind, body, soul level.
Mhm.
If you don't, it's not the right way, right?
Right.
So now how can we do this is we have to spend more time with our patients. So we want to assign, let's say 100 to 200 patients per provider. We don't want to rush on it. It's all about quality, not quantity.
Mm-hmm.
And if we take care of our patients and then prevent the disease by learning what they're going through and giving them access to care, they can call us, they can text us, they will have a health coach, they will have, other than doctor, other modalities of care. And what are those? We provide some technology based care. We see the technology they are using. We are able to analyze the data. We want to see how their day to day is happening. For example, I'll give you, we had a diabetic patient. Now, newly diagnosed diabetes was already out there for a long time,
Mm.
but not having a good health plan with a large copay or a deductible, meaning he's not able to see the doctor. Even if he comes, it's a waiting time for, let's say, a month or two,
Mm.
but the disease does not wait for you,
Mhm.
right? Now he's
Doesn't.
starting to pick on complications from diabetes to heart disease to neuropathy to kidney disease. Now, if we can simplify this process, get the patient get in the system faster, and then spend more time to them, then we can learn so much more about the patient and activate our team. So now, working as a primary care, we work with specialists who really care about the patients, but we try to be the quarterback for the patients, getting as much data, talking to them in our clinic, but also from the home by technology, and then listening to them, giving them access that they can reach out to us by texting, right? With the way healthcare is going, we have so much medical legal. Doctors have to do so many patients,
yeah.
and they are scared to be in contact with them. More and more providers are getting employed. Now, if they are in an institutional based care, they have to deliver so much more other than the pure patient care. There are two aspects of healthcare. You have pure patient care where you want to listen to them, talk about their basic needs, and then come up with a plan. On the other side, we have to document what we are talking about. We have to do with so many other medical legal steps. So the time is same. Either we can spend time with the patients taking care of their basic needs and help them with what they need, or we do all of the above. Now, what this membership helps us with, we know we have this set number of patients who really care about their health, and we want to go all in deep for them. We assign a health coach. We go with the providers to be in touch with them. Let's say they are not able to get an appointment. We want to reach out to them, finding out is it some kind of a mental health issue as well. Because if you have more than two diseases, the study shows patients started to have some mental illnesses as well. They start closing up because of the barrier to see a provider, primary, secondary, specialist, so much work. Imagine 65 to 85-year-old patient population, they need so much help.
Right.
Now,
right.
if they have so many steps to follow, it's so hard. But if you have a quarterback who gets it and then gets them connected with their needs, and then they are able to reach out to them by texting, why not?
Right.
Why we have so much barriers in healthcare that they are not able to do the basic steps. Now, once we get the data, we see where they're suffering. Is it mind, body, soul? We can go after it, right? But if we see there are barriers where they are disconnected, they are being a prime example. I had a patient with diabetes, blood sugars going off the chart. Then office is not able to take the call. They go to the ER. In the ER, they see a cardiologist, endocrinologist. Then they have to see gastro, like 5 other doctors. By the time the patient get discharged and get to come back to the primary care, he's lost. Where should I go?
Right.
But it's the same body. If you have a personalized way to get the patient in and get all of those appointments taken care and be the quarterback, talk to the doctors and go to bottom of the problem, which is diabetes, not 5 other problems.
Right.
It's the same body. You can divide into different organs.
Right. And you can treat that diabetes, and that'll affect all those organs and make them healthy and better again.
There you go.
So as we close this third segment, membership,
Yes.
what's it cost?
$99 a month. Unlimited access to healthcare.
$99 a month. And do you pay it monthly, or you just pay it one time for the year?
You can do monthly, you can pay in full,
Okay.
and we discount them. We have financial options for them.
Well, I'll tell you what, I want to dig in on the fourth segment about this health coach. You keep talking about quarterback, keep talking about health coach. All of us need to be accountable, and I think that's what you're trying to do with Synergy Health 360. You're listening to Health Futures, Taking Stock in You. I got Dr. Jain here in the studio with me. We're down 3. We got 1 more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our final segment here. I have got Dr. Jain here in the studio with me. He is with Synergy Health 360. If you missed any of the segments before, you can catch them up on our website at cypresshomecare.com. Click on the media button and hit the radio button just below it, and you'll catch this one and many, many more. So, Dr. Jain, we talked about the subscription, and we talked about integrated health, and we're talking about mind, body, and spirit, and we're talking about just not sick care, because that's really what healthcare is. We're really talking about healthcare and promoting healthcare. And you kept using this phrase, quarterback, and you kept using the phrase also about health coach. And I really believe as humans, we all need to be able to have somebody to be accountable to. And I really want to understand how that works within Synergy Health 360.
That's perfect, Roth. Yeah, you just helped me a lot to get to the main issue of healthcare right now. We don't have enough doctors, primary care doctors, most importantly, to take care of our aging population with so many newcomers coming into our own community. Last time we did a math, we have almost more than 1,000 patients coming in a week needing new doctors. Where are they coming from? We don't have new set of doctors
Right.
being built the way they used to be. So now we have to have a team approach. We have to involve our new generation to take care of our seniors, take care of themselves, caregiving and whatnot. So the concept has to be beyond the healthcare providers. We need to engage patients themselves, family members, and then other set of young people who have passion for healthcare and wellness. We have to nurture them. We have to show them the impact they can provide to our community.
Mm-hmm.
So the concept came from University of Arizona Integrative Medicine program, where we have doctors doing the fellowship, but we can also coach and teach others who have the passion for healthcare. And then, like the way we used to have medical assistants, we have health coaches, life coaches, personal trainers. There are different modalities of care available, but we need to have a quarterback who gets it, who see where the evidence-based techniques are coming in, and it's not fragmented. The patients who are going through medical conditions have a different mindset than the healthy patients. We gotta approach both ways, keeping the healthy more healthier, optimize their mind, body, soul, but who are already out from the prevention to primary and the secondary disease processes or in the rehabilitation side. We have to have a spectrum of care. That's where the health coaches comes in. They report to doctors, providers, NPs, PAs. We have different levels of care we can provide, but working as a team, getting to know the patient, giving them more time, more data. Technology can get us so much out right now. With AI, we have sensors in homes. We can detect before they fall how the heart rate and the blood pressures are going, how the gut health is happening, how the lab work with hormones are going, neurotransmitter. There's just so much out there with the new technology, but who is solving that complex data in a simpler way for the patients to process and do their day-to-day living in a smoother and better way?
So, talking about, and I love this about you, and I love this about Synergy Health 360. You keep talking about the home, and we want to keep people at home. Do you guys go to the home? Does the health coach go to home? I don't know this answer, and I don't mean to be putting you on the spot, but if needed, and can you be a patient of Synergy Health 360, or do you need to have that membership to be able to get that?
Well, we can do both ways. We have two different models. One with the insurance model. We see the patient when they get discharged from the hospital. Our first thing is they don't get readmitted because it's not good for the patient, not good for anyone. Then we see how they are being taken care once they're out of the hospital. We try to get them seen in the clinic within that same week,
Mm-hmm.
if not the next day. And then when they hear out all their medical conditions, we have chronic care management team who works with transition care management
I
team.
love it. Yep.
Then what happens is we also connect with remote patient monitoring.
Mm-hmm.
Now we want to have the independence and the dignity and the experience for the patient and healthcare in a setting where they're more relaxed. Then your vagus nerve, or most of the parameter will be better anyways. Rather than pushing them out in another nursing home or another facility, how can we deliver it at the basic level where they have the most resources, more comfortable? Especially you have to see they are aging.
Right.
So their cognitive decline is there
Right.
on top of the sleep they did not get in the hospital or in the nursing home. Now, how many resources can be provided in a home setting is very important. But let's say they're not ready for it. They are very high risk. They will be falling. They need care like assisted living. So those locations we try to staff good assisted living locations or independent or skilled nursing. These are just different post-acute care settings to connect with the providers and the patients and the caregivers, the based on the needs they have.
Mm-hmm.
And then being a primary care, we have to make it as a quarterback for them, because then they get stuck first with the hospital medicine doctor
Right.
who just met them first time.
Right.
Then they saw a cardiologist. Then they got discharged out in a post-acute where they found a new rehab doctor. All these providers are doing amazing job, but their job right now is to get them less sick and be discharged back to the home setting. Then who's taking care of them where 97% of the time they are there? All
100
this documentation, medication reconciliation, lab work, you name it. Now you have a patient who's diseased, cognitively not up to par, and then comes to the caregivers. They have jobs, they have so many things to do, but they love their parents. They need to do the best for them. That's where we come in. We want to send some resources in conjunction with the hospital. We have certain hospital systems in Valley, amazing. They are doing such a good job. We partner with them. They have nurses, care managers, social workers going out in the community, making sure they have all the resources they need. They report to us. Then we do that complex data simplified for our health coaches to go to the basic needs for the patients. So they have 3 level of care: home care, clinic-based care, nursing home-based care.
When I hear you describe all this, the fact is they're putting a Band-Aid on every issue that is coming on, but they're not really focusing on getting the person well. And I hear you loud and clear, and we're getting ready to close this entire show. And Dr. Jain, I definitely want to have you back and maybe do it with Dr. Deering. But what I hear you saying is that we can work on the wellness piece. We can fix it, but we can make you better, and we can make you better by assembling a team. A quarterback, but you have all these different varying specialties that you aligned yourself with. So if you want to learn more, go to synergyhealth360.com. And is there a phone number? Can I give them this number here? 480-553-6168. They have 2 locations here in the Valley. They got one here in Scottsdale, and the other one is in Peoria?
Phoenix.
In Phoenix.
Northwest
Phoenix. Anything else you would like to leave with our listeners as we say goodbye here?
Well, thanks for the time. You're amazing.
Well,
We'll be doing few more things over here, expanding the services irrespective of the location. Home-based care, call us. We are here for you.
Thank you. And I want to wish everybody that's listening here today too a happy 4th of July. Be safe, be happy. Happy birthday, America. It's hard to believe it's 249 years. Next year it'll be 250 years. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.